Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.
Good afternoon and welcome to the City Club of Cleveland, where we're devoted to creating conversations of consequence that help democracy thrive. It's Wednesday, December 11th, and I'm Marlene Harris-Taylor, Director of Engaged Journalism at IdeaStream Public Media, and I'm your moderator for today's conversation. According to the Ohio Department of Health, the infant mortality rate not only serves as a key indicator of maternal and infant health, but it's also an important measure of the health status of the whole community. This year at the Cleveland International Film Festival, a documentary film called American Delivery showcased nurses' heroic efforts to support mothers and babies across the globe. The film certainly hit home both literally and figuratively, as it featured Cleveland mothers and won the coveted Audience Choice Award. We're going to see a few clips from the film during today's forum. Now, in Cleveland, the infant mortality rate is one of the worst in the nation. I know that's not a surprise to anybody in this audience. And according to the Cuyahoga County Board of Health, Black babies in the county are almost 3 times more likely to die before their first birthday than white babies. And while there have been some improvements, the rates remain persistently high. To support women and babies, we must go beyond healthcare delivery. Public-private coalitions like First Year Cleveland are rising to the challenge, building a community movement that identifies causes and develops sustainable, system-driven solutions. So, what can we learn from the maternal and infant vitality movement, and how can we ensure all mothers and babies are guaranteed healthy beginnings? Joining me on stage to discuss this are Carolyn Jones, the director and executive producer of the documentary I was just referencing, American Delivery, and Angela Newman-White, executive director of First Year Cleveland. If you have any questions for our guests, you can text to 330-541-5794, and City Club staff will try to work your question into the Q&A portion of the program. Now, before we begin, I'd like to set the stage for today's conversation and share the film trailer of American Delivery with all of you.
It might look like the moon, but it's something even more way out. It's a picture of a human fetus inside its mother's womb.
In the 1950s, we shifted to thinking that anything medical was the preferred approach. When I was a nurse in labor and delivery, working night shift, I bought into all of it.
Maternal mortality is dropping dramatically around the globe.
Akina mama, mnaendeleaje?
The one exception, the United States, where the rate is actually rising.
The U.S. is the most dangerous place in the affluent world to give birth.
I know about misdiagnosis. I'm a 2-time survivor of preeclampsia.
For Black women, it's become a literal life or death situation.
I never wanted to have any type of surgery. It's kind of like a fear for me.
The statistics are unacceptable in a nation as technologically advanced as the United States.
It goes back to listening to women. Nurse midwives are specialists in low risk.
Technology is very important. Hospitals are very, very important. But I think that's a place for people who really need them, people with complications of pregnancies. But that's not the majority of pregnant women.
Quite often, women, we care for so many people in our lives. We don't do a good job of caring for each other and caring for ourselves.
Wanting that for more women was what motivated me to become a nurse midwife.
You ready to make it? Almost.
This can't just be about birth. This is about life. I survived something tragic, I believe, to tell a story about it and to make a difference.
There's so many wonderful things about having the power to choose how you give birth. I want women to have all the options.
I was made for this.
It's called labor for a reason, friend. You're gonna work it out.
They make it look so much easier.
On TV, right?
Yeah.
Just have a baby. It's perfect.
Carolyn, congratulations on winning that coveted Audience Choice Award at the Cleveland Film Festival.
Well, thank you. You have a very lively audience here, and it was wonderful to win that award. It truly was. It was a good shot in the arm for that film.
So let's talk about the film. Where did the idea for the film come about, and how did you find backers, and who was going to be on your team?
Wow, well, there's a lot of questions in there, Marlene, but thank you for asking. So I've been looking at issues in the country through the lens of nurses for about 15 years. The reason why I've done that, and I've looked at everything from the opioid crisis to gun violence to returning war veterans to our prison systems, lack of insurance, all kinds of issues that affect all of us. Going on the wings of a nurse as a filmmaker has been so rewarding because it's a way to get in really deep, really fast and find out how all these things affect the human body. And you go in without prejudice. You go in with an idea of caring for everyone equally. And so I'm able to address these issues without politics and without judgment. So it's been a really wonderful way to look at the issues. I also feel as though nurses play a unique role in our communities, and they're underappreciated and underrepresented. And so part of my kind of mission, as it's become over the last 15 years, is to raise the volume on the voices of nurses, because I think they're in this unique position to see us holistically and not kind of get into the weeds.
That's wonderful. I love that.
I know. I love it too. And the nurse who inspired this whole film is right here from Cleveland, Joyce Fitzpatrick, who is the director of the Marion K. Shaughnessy Nurse Leadership Academy at Case Western. And she is a woman who has just touched more lives than you can even begin to imagine all around the world, and made a huge difference in maternal mortality as well. So she inspired the film. The news inspired the film. I look at the headlines everywhere, and I was not only struck by our maternal mortality crisis in the country, but how Black women were suffering so much more than white women, and Native American women as well. It's just been a really extraordinary education. And as I went out into the world and discovered that people don't realize what's really going on, I wanted to raise some awareness. So that's basically the origin of where we came
the story.
From. Yeah.
So I'm so glad that you were able to connect with the folks here in Cleveland, because this is an issue that we have been paying a lot of attention to as a community, but I'm not sure, Angela, are we moving the needle? What's the state of where we are on maternal mortality and the numbers in Cleveland?
Well, unfortunately, for those of you that were able to tune in from the press conference yesterday that was hosted by the County Executive's Office, we are trending in the wrong direction. In 2022, we had the unfortunate number of 91 families that lost a child, but in 2023, it shot up to 112. Our infant mortality rate increased last year to 8.82, and it's also, the racial disparity is still 3 times that compared to Black to white families. And so, despite all of the phenomenal work that we're doing on the ground, because we are doing the work, from our, direct service organizations to the number of amazing Black-led work, I think that, we just need to place more emphasis on our larger, systems issues and the inequities that exist. How are we best supporting women, not only during the pregnancy journey, but way before she gets pregnant?
Absolutely. And there is a connection between maternal mortality and the infant mortality rates, isn't there?
Absolutely. I mean, when you think about the role of healthcare, right? Healthcare, I don't believe, is the solution, but it is a part of the solution. And so when we think about the experiences of Black women through the life course, Black families in general, the exposure to racism, discrimination, and the limitations that are placed on families that are outside of our control is the problem. And so when you present in a healthcare setting and you come with all the lived experience, and yet are still treated and unfairly and differently from your white counterpart, you know, unfortunately, the outcomes are inevitable. And so, you know, First Year Cleveland's perspective, it's important that we continue to hold people accountable, hold the systems accountable to doing the right thing, not only within the healthcare setting, but I'm thinking, you know, in the private sector, business sector, all of the above.
And you know, we often try to use language to bring about change. And we were talking about how we're trying to think about not this as maternal mortality, but maternal vitality. That's the new phrase?
Yeah, absolutely. So way back when I was a part of the One Community movement in zip code 44128, it's a resident-led initiative around, you know, asking people what they need and doing it. And when we came into the community and started talking about infant mortality, and folks said, why do you keep telling me about all of this devastation and death? I live here, what am I gonna do about it? And so it's like, it's an eye-opener to stop talking about, you know, everything from a negative perspective and look at it from an assets lens. And so how do we uplift vitality, celebrate Black joy, all of the wonderful things that are happening, and do more of that as opposed to focusing primarily on death? And I think if we shift the narrative and do more of what's working, we'll make some headway.
So Carolyn, in the film, you talk about the importance of that nurse-patient relationship, and we're going to show a clip from the film, and if you could like kind of tee it up for us, what we're about to see.
Sure. Well, the nurse-patient relationship is it's such a strong connection when someone's having a baby. You know, we need to listen to women, and if there's one thing that everybody said to me as I met women across the country, it was that they didn't feel listened to, they didn't feel heard. But they spend more time with nurses than anyone else. So this is a great place for us to sort of open a door. In the film, to speak to what Angie just said just for a moment, you know, this idea of presenting information in a really negative way or in a very positive way. We live in these silos. We hear a lot of negative information all day long. As a filmmaker, if I'm trying to change people's mind and introduce them to an idea, I can't start from a place of negativity. I have to somehow find a way in to present the information so people can accept it and also be a little bit entertained. And that's what the clip you're about ready to see is. We haven't changed much since 1950, and I needed to say that some way, somehow in this film. So I tried to do it with a little bit of humor, but also to kind of wake us up to what the thinking really is. So let's take a look.
Okay, let's roll it.
A few days or a few weeks after your baby is born, you may feel depressed. Perhaps you feel that you can't cope with all your new duties, that you're not doing enough for your baby, or that your husband doesn't show enough interest. Don't worry about these blues. Get out to a beauty parlor.
In those days, postpartum depression was still called the baby blues. You had it for a couple of days and then you were done. We now understand that more than half of maternal deaths happen in the postpartum period. But after a woman gives birth, she goes home and everybody forgets about her at a time when she needs attention and care. I wish we could create a system that's not a medical system, it's a care system. We wouldn't just save lives because we would be recognizing physical symptoms and giving women medicine. We would be saving lives because we would be giving them help and nurturing.
So powerful.
Well,
so powerful. And it's always so entertaining to see those old clips. Just go out and get your hair done.
Get your hair
and
done.
And that'll take care of the baby blues, right?
What were they thinking to say that? But I'm so glad we were able to share this because it led me into one of the things I loved filming in Cleveland, which was the Nurse Family Partnership Program. What an extraordinary program this is. And you know, having those touch points with a new mom from the very beginning that she finds out that she's pregnant until that child is 2 years old It's a brilliant program that I would love to see expanded. It's one of the places where I really feel like the needle's moving in the right direction. And it was a beautiful thing to witness here. I'm so grateful to have it in the film.
It's so wonderful to hear that the needle is moving in the right direction in some areas, right? But after you spent some time in this space and did the film, what were your big takeaways around this issue?
You know, I'm always looking for solutions. So I'm trying to find solutions or something that we can do to make things better. And this is such a complicated issue. And it's easy to get bogged down by how hard it is to solve. And I think partly one of the reasons why I like to share the stage with Angie is because I think she's coming from the top down, like looking at the systems and really how we can make big change. And I also feel like we need to do some work from the bottom up. We need to raise awareness. Women need to know what they can ask for. And as I was working on the film, I just found that there was so much misinformation out there. People are getting so much information from TikTok and not from really places that are you know, it's dependable facts.
Everybody's not listening to IdeaStream?
They should be. They should be, but it's a big world out there, and there's a lot of TikTok going on. Not that that's always a bad thing, but I do see that there's misinformation. You know, I would talk to people about midwifery, and they'd say, oh, does anybody really do that? Is that like when you give birth in the woods? I mean, you know, this is America, but this is the level of understanding sometimes of what some of the things that we're talking about. A lot of this audience understands what we're talking about, but a lot of the rest of the country doesn't.
Mm-hmm. Angela, this is a big issue, and it's hard to course correct, right? Hard to move the big ship. And you mentioned earlier that more work needs to be done with the systems. And you mean the hospital systems.
Yes,
in
yes.
Cleveland Clinic, University Hospital, Metro Health. So what's the work that needs to be done there?
Well, I mean, we want to acknowledge the work that is currently being done. You know, I'm so excited that Metro Health is offering nurse-family partnership and going to be expanding their eligibility to serve women that have more than one child and, you know, past 28 weeks. And so there's an opportunity to have a nurse visit you throughout your pregnancy. I would like to think that we need to also pursue different ways to fund nurse-family partnership. You know, right now I know they're heavily you know, dependent on grant dollars and philanthropy, but are there opportunities to pursue Medicaid reimbursement for these are clinical, you know, providers visiting folks in the home? And so thinking about sustainability and expansion within all healthcare systems, you know, that's an opportunity.
Why is that not the present case?
You know, honestly, I think it's because it's taking care of women. Like, we don't do a good job of taking care of women and prioritizing pregnancy. We can, you know, tie that to the lack of paid leave, the access to childcare. There's a whole list of, you know, opportunities to support women and families that I think that we're behind the 8 ball. Mm-hmm. But you know, I wanted to mention too that, you know, midwifery is expanding in all of the healthcare systems, and we also have a local Village of Healing. I see Dana Langford in the audience, where, you know, this is a Black-led for Black women, and we have, you know, nurse midwives being offered in that space too. So, you know, regardless of where you're going, we now are having more access to midwives. There's Team Birth that was recently launched at the Cleveland Clinic and approaching UH, and that's a patient-centered model. And so there are, you know, there's traction being met, I think, but we also have to think about how are we funding healthcare? You know, how are we compensating nurses? How are we compensating OBGYNs? You know, what is the give and take when it comes to maternity deserts? You know, why don't we have more labor and delivery hospitals? It shouldn't be an issue for families to have to travel to deliver their babies, to have to travel too far to where they could have avoided, you know, a complication with the missed time.
Because many of the hospital systems are no longer have baby delivery units, right?
Yes,
yes. And that's basically a money issue, right?
Yes.
Those operations don't make money for the hospitals, right?
Correct.
So they have basically made the access less. Absolutely. Instead of going the other way. So we've talked about the great things, but other than expanding Medicaid for workers in this space, is there anything else that we could be thinking about changing locally?
So we recently, First Year Cleveland host community partner gatherings, and our last meeting focused on healthcare, and we invited our sister project from Cradle Cincinnati to present their Mama Certified model. And there's an opportunity here for data transparency and accountability, asking health systems to actually publicly report out their outcomes, their C-section rates, their preterm birth rates, by provider, by location. And so that will provide the patient the opportunity to choose, like, what could be the safest place for me to deliver my baby? And we would hope that we're not trying to shame particular systems, but to encourage folks to raise the bar, to try to identify ways and effective strategies to hold the physicians accountable, to hold their front desk staff accountable, to make sure that we are assessing what the true needs are in the community and we are responding to them.
So Carolyn, when we look outside of Cleveland on the national level, do we see pockets of places where there's some pilots going on that are exciting, or some national trends that maybe haven't made it to Cleveland yet?
Boy, I wish I could say yes to that, but I think that some of the things that you're doing here are really extraordinary. It's a problem all over the country. You're talking about access, right? We went to parts of Mississippi where people have to drive 4 hours to give birth, and that they're sometimes giving birth by the side of the road because they can't make it there in time. There are parts of the country that, are dealing with so many issues that we're all looking at. It's complicated. I think that the one thing that I've seen that works more than anything is a community approach, an opportunity to have these touch points with the patient that are more frequent, more often, listening, hearing the women. That's where I saw change. And in other countries, midwifery is perfectly normal for women who have uncomplicated births. And so if we could introduce that and get more comfortable with that, we did see, well, I'll tell you one place where we did see something I was really interested in witnessing, which was at University of Kentucky Hospital, where the midwives were able to be with the moms on the labor and delivery floor. And the mom could go in and have her baby and never see a doctor if it wasn't necessary. But if something did go wrong, the doctor was right there. And it was a wonderfully integrated place that kind of got beyond the sometimes tension that you find between OB doctors and midwives. And that is something very real that I think that needs to be addressed. And if we can transcend it, and when we do transcend it, the outcomes are better.
I have heard about that tension, particularly with like doula programs. And we have made some great strides in doula programs in the Cleveland area. But I have heard that sometimes the doulas, depending on the hospital and depending on the staff, may not be welcome for the birth.
Yeah, I think, with Birthing Beautiful Communities, I know Jasmine's in the room, they've done a phenomenal job of, normalizing the presence of doulas in the healthcare system, but that's not always consistent in every setting. And I think, we do need to continue to work on that. Recently the state did approve some legislation that would provide reimbursement for doulas, which I think would provide more of the acceptance, I guess, on the healthcare level, because when you see somebody that may not be a hospital staff trying to participate in the labor and delivery process, I think that there could be some reluctance from providers, because they are there to advocate, right? Doulas are there to let the folks know, like, this is not right, you need to do this and you need to do that. And so I'm hopeful that, as they continue to grow and evolve, that it will be just a standard of care, coupling that even with our community health workers. We do a great job here with wrapping ourselves around our families. But I think all of our challenges they all have to go home, right? And once they get home and they have to go to work or they have to do other things, that's where we're lacking, like, as a system, to make sure that they have all the necessary supports to, implement all of the behaviors that we recommend in the different referrals we provide. Like, how do you actually get to that point?
So how did you find the Cleveland women that you featured?
Oh my gosh, well, we loved filming here, first of all. We filmed at Metro Health, and we filmed a number of births. And I was struck by, even though there's a certain speed that all things need to kind of move along and keep things rolling forward, they were very focused on skin to skin right after the baby was born, so that was really wonderful to see. And it felt like a real community approach there. So basically, the women in Cleveland have been amazing to work with. We have a couple people from Nurse Family Partnership here today, Kim Green. It's such an extraordinary program, and I was struck by how deep within the community and how intimate it really is. Deanna is also in our audience. She was the Nurse Family Partnership for a young woman who was dealing with anxiety and depression, which is another whole big topic about mental health and pregnancy. And they're able to like get over the threshold of the home and get in there and really help. So we were very moved by the women of Cleveland, which is why you take up more than half the film.
That's wonderful. Well, you know, one of the things that I've learned over the years, and particularly when we were creating the podcast, Living for We, if you guys haven't had a chance to check it out, please do, where we talk about Black women in Cleveland and many of the struggles and in the healthcare system. And one of the big things we learned through that podcast is that advocacy is so important. When women are in doctors' offices, healthcare, all of us, not just women, really. Advocacy is so important. If you don't feel like you can advocate for yourself, it's so important to bring somebody else, right?
Absolutely. I mean, I think that's why we do have a lot of the supportive organizations in place to help to advocate for the on an individual level, but then it's also important that organizations like First Year Cleveland are able to advocate on a city and a state level and potentially a federal level, because the goal here is to solve the root cause and not to provide, you know, to always have to provide treatment for an unjust society. And so, you know, I think, you know, any opportunity that we can shift the power to the patient or to the family to not only be an advocate for themselves, but actively participate in other advocacy opportunities, because as we use our voice as a collective, I think that's when, you know, change happens.
So with the current political climate, do we think there will be moves towards making Medicare, I'm sorry, not Medicare, but Medicaid more available to help with doulas, with freestanding agencies, with Medicare reimbursement and so forth?
I'm fearful. I mean, I'll just be candid since this is the stage to move democracy forward. I'm fearful, you know, with the proposed changes to Medicare and Medicaid. You know, everything remains to be seen. So we're going to see what happens, but I'm concerned about the economic stability of communities, and honestly, the focus on equity, diversity, and inclusion cannot go away. We cannot, you know, I think we've made a lot of progress as a nation, especially in Cuyahoga County, around really recognizing how important equity is in all the things that we do. And if we scale it back, I'm concerned. And so, but I think here locally, there's so many great people doing the work, so we're going to keep going and we're going to keep trucking along.
So rather than expanding these programs, you think it's probably going to go the other way? It's going to be scaled back?
It could be, but again, we have to wait till, you know, next year. But I'm confident that with the commitment and passion of the folks here in this community, that we're not going to give up. I think that the challenges will just be different, and it's just going to take longer to reach that North Star that we're trying to reach.
Mm-hmm. What do you think about that, Carolyn?
Oh, I mean, it feels a little dark, to tell you the truth, but I think I'm really focused on what matters to me, I think, is that we remind people what we're fighting for, whether that's Black moms or white moms, but the children of the future of this country. You know, we show 5 births in this film, and I was struck by those births. And I've given birth, but you don't see your own birth, kind of. So anyway, when you film a birth, it's a whole different experience, right? And seeing these babies come into the world, I was so struck by the majesty of that, of what a miracle it is. And why aren't we protecting that as a nation? Why aren't we saying this is a wonderful thing that we're able to do? We need to focus on it and make it better for everybody. And so the film, I hope, reminds us that, you know, seeing these 5 babies come into the world, I think, brings you to a place that reminds you what matters. And we need to fight for that, whether it's so many things that Angie's been talking about and so many things that we witnessed in the film that can be better if we just cherish this incredible ability we have to bring children into the world.
What an awesome experience you had making this film.
So lucky. I have the best job ever.
But I'm thinking about what you said, though, Angela, in terms of DEI, diversity, equity, and inclusion. For example, how would we know if we're making progress on the maternal mortality rates if we're not allowed to collect the data by race?
Exactly. That must be a rhetorical question. I mean,
it is.
Right, that's what's I mean, because that's what's important. You know, when you have to break down the data, right? We could say, you know, 8.8 is not an acceptable infant mortality rate, you know, but that's an overall, right? But when you break it down by race, you know, there's a huge disparity, and then when you look at it by community, there's an even larger disparities, even based on where you live, and so it's digging into the data that tells the real story, and it identifies, you know, where you need to focus all interventions and investments in. And so if we don't continue to do that, I think that, you know, that the folks with privilege will continue to prevail, and the folks without it will just be much more challenging.
Well, this has been a wonderful conversation. I'd love to keep going, but we want to let these folks in the audience have a chance to get in on this. We are about to begin the audience Q&A for our live stream audience, and for those joining us, I'm Marlene Harris-Taylor, Director of Engaged Journalism at IdeaStream Public Media and moderator for today's conversation. We're discussing the maternal and infant vitality movement and how we can ensure all mothers and babies are guaranteed healthy beginnings. Joining me on stage is Carolyn Jones, the director and executive producer of American Delivery, the Audience Choice Award-winning documentary at the Cleveland International Film Festival, and Angela Newman-White, executive director of First Year Cleveland. We welcome questions from everyone, City Club members, guests, as well as those joining us via our live stream at cityclub.org. If you'd like to text a question for our speakers, please text it to 330-541-5794. That's 330-541-5794. And the City Club staff will try to work it into the program. So may we have the first question, please?
Yes, we're actually going to start with one of the text questions we've already received. In the film, there were nurses in California who noticed women were dying in childbirth due to blood transfusions not reaching them in time. The hospital changed this. Can you walk us through the steps they took to improve this situation?
Oh, so this is actually a few years ago. A woman named Deborah Bingham was behind starting this effort to try to understand why the numbers in California were so high for women dying during childbirth. And what they discovered was that there wasn't a good record of how much blood was lost during the birth process. And so she and a group of other people got together and figured out a way to measure blood loss so that when the doctor turned around and said, you know, what's going on, the nurse didn't say, you know, the patient has lost a lot of blood, she's lost exactly this much blood. So measuring it made all the difference in the world. And they were able to lower the maternal mortality numbers in California within 5 years by an enormous amount. But the rest of the country is now doing this. And so this is pretty prevalent, not only just in our country, but it's gone to other countries as well.
That's great. Okay, we're going to go to our next question.
Good afternoon. First, a shout out to IdeaStream for the wonderful series called The Midwife. I love it.
Thank you. I'll take all the credit.
But my question, one of the things that I've read and have had confirmed by a number of doctors is the myth that Black people do not experience pain the way white people do. Doctors are actually being trained to believe that. I read that they believe that Black people have thicker skin, fewer nerve endings, and I've been told that contributes to the infant mortality rate. So could you talk about that terrible myth, and has anything changed in the training that doctors are receiving?
Thanks for that question. I've heard about that too. I heard that used to be a thing in medical school. I don't know if that's still happening in medical school, that doctors are being taught that. But Angela, can you address that?
Well, I'm not a physician, nor did I receive any medical training. But I am aware, so, you know, it's called eugenics, right? So they, you know, during the times where folks were enslaved, I mean, there has been a lot of experimentation on enslaved folks, on enslaved people, and all these determinations, these false, you know, myths around pain tolerance and things of that nature, and it has been taught in a lot of the schools. And when we even think about the other documentary that was done previously, and I'm drawing a blank, but talked about how, you know, there was a concerted effort even in this country to close down a lot of the black medical schools where you would be actually taught the truth. And so, you know, again, I can't confirm nor deny if there's anybody here from medical school that can make the comment, but
I see some hands out there.
Okay, great. Because when there was all of the legislation that passed around, even pulling back all of the DEI work that's being provided in, you know, how we administer our academic curriculums, like that's a fear of mine. And so I'm hopeful that in the future, you know, we can at least retrain, but then also make sure that all of our future providers are taught the truth, right? The reality.
Right. Well, you know, one interesting thing, when I was a health reporter, I heard that there was one instance where this worked in favor of the black community, and that was during the beginning of the opioid crisis, because when people would go to the ER and say, oh, I'm in pain, I need meds, the doctors wouldn't believe the black folks, basically, and wouldn't give them opioids, but that kept them from getting hooked on opioids. So I know things have changed in that space since then, but that was one unintended consequence of that kind of bias. Okay, we're going to go back to our questions.
Thank you. This is a question for Director Newman-White. So the bad news is Ohio's recently reported most recent data as being the most deadly place for black mothers to deliver their baby. We have the highest black infant mortality rate of all states in the country. But in meeting with you, I was very moved. I'd like you to say a word about the programs in the community that actually teach us these facts are movable. Within 1 or 2 years, you can drop those numbers. And I think I recall you mentioning there were zip codes where infant mortality black infant mortality didn't just match white infant mortality, went to 0 in these zip codes. So within 1 or 2 years of intervention. So I think if that's true, then this catastrophe is really something that we can change if we had the will fairly rapidly.
So what you're speaking to is the one community effort. So it's using a collective impact framework and basically doing place-based work. So, you know, we found early on that when we try to implement, you know, countywide interventions, they weren't most effective for our black families. So white families seem to have received the greatest benefit to these larger systems changes. And so we kind of decided, like, let's focus on communities that have the highest rates of infant death, where we convene folks and ask the community, what do you want? What do you need? What can we do more of? As opposed to saying, these are all the terrible things that are happening and, you know, I'm sorry. And the community told us what they needed. At that time, that was when we discovered the labor and delivery desert in the southeast quadrant of the county, whereby there were 4 emergency rooms and no labor and delivery. At the time, 2 labor and delivery hospitals on the east side and 5 on the west side. 50% of the births happen on the east side and 60% of the deaths. And so, you know, we were excited that there is now a Hoosiers delivering babies on the southeast quadrant. But when we talked about that with the community, they said they weren't even thinking about that. What they asked for was opportunities to meet their neighbors and build relationships. And they talked about the importance of how do we support families with breastfeeding, and can we do it like through the churches? Because a resident said, I was told to go to the bathroom to breastfeed my baby, you know, and so we went to the pastor. We asked, you know, why don't you allow people to breastfeed in the sanctuary? And he said, well, there's no eating or drinking in the sanctuary. And I'm like, okay, well, let's find ways to, but anyway, but it's like things like that where you don't think about, you know, building relationships between residents, but asking people what's meaningful for them. That created a groundswell to where folks saw the immediate benefit of them using their voice, and we think that led to a 0 infant mortality rate in 44128. We later worked with Mayor Blackwell in 44137, and this is a similar interventions where the community there, though, just talked a lot about how do we make sure that first responders are more equipped to responding to families who have children. And so we provided trainings and also did a lot of out-of-school time activities for youth. And that's in that community, when we were active, 0 babies died. And so what the point is that when you ask people what they want and you do that, that's the evidence base behind the work. I think we do a lot of evidence-based interventions that work for a particular population in a particular community. We don't take into account individual experiences and context. And so if we do more of that, I feel like we'll make, you know, more progress.
That's amazing. to get it down to zero in those particular communities. But there's some people who think, oh, I'm sorry, do we have another question here? I just have one quick follow-up. There's some people who think that if you just educate everybody, you know, educating everybody is the way out of this. What do you think about that, Carolyn?
I think we can raise awareness. We can teach people what they can have. People don't know about doulas very often. People don't know about midwifery. They don't know what they can have. They don't know what to ask for. So it's not enough. Just educating people simply isn't enough. But raising awareness and again, reminding us what matters, that does go a long way. And I think the two things together will bring us some success. But I think we need to work this from both sides.
Mm-hmm. Well, thank you for your patience, and we'll take your question.
Of course, no problem. Hi, my name is Faith Boone. I'm a marketing consultant. I'm the founder of Boone Logic. I work with a couple of clients that are in the maternal infant mortality space. Our healthy community has a platform so organizations can come together and talk about these issues. And I also worked for the Centering Pregnancy program through university hospitals. And these are both great entities. The thing that I'm struggling with is not just trying to reach youth, as in, you know, like children, but young adults. So I heard what you said about TikTok. So people are out there using Instagram, TikTok, maybe not Facebook anymore, but to get their information about, you know, what's going on with them or what's going on with members in their family. And I'm just wondering, like, you know, it's still a struggle. Even when you give them these outlets, these mediums that's supposed to be connecting with them, they're still not connecting with it. And it's more like that engagement pool. It's like, you know, don't you want to know what's happening with your fellow person that's in the same situation as you? So from your vision, because I love what everyone said up there, just what do you guys think that we can do to not just reach children? Because I think, you know, there's a certain point when children get to middle school and high school when they get to learn about these things a little bit more and they make their own decision on where they want to go forward. But with young adults, you know, those ones where you said it yourselves, we're supposed to be getting to them before they're pregnant. So how do you think that we can reach them more? Is social media an outlet for that, or is it a caveat?
Great question. Yeah, social media does wonderful things at times, but what is the way to reach that young adult population, meet them where they are, if you will?
I mean, we do find, yes, social media is a pretty effective way to reach, honestly, 10 to like 25-year-olds. And it's building a network and forming like groups. And so folks can feel better connected. I find that the place-based work in your own community, it kind of works if you can have partnerships with the schools or local colleges, sororities, fraternities. But I think word of mouth is the best way. If we can kind of build the groundswell across the lifespan to normalize conversations around overall health and well-being, not only would we hope that it would motivate you know, different decisions around health behaviors, but also have folks thinking about the reality of access to actually implement these suggested health behaviors. Because if folks don't know, like this, you know, Maya Angelou said, you know better, you do better, right? If people don't realize how challenging a goal is to achieve and what the actual path is, they're not going to step in to make it easier. And so I think from whatever capacity that all of us come from, it's important that we help to navigate and come up with actionable steps and not just raising awareness or information. But social media is a pretty effective tool, unfortunately. It can hurt and, you know, help us. I'm working on it. We're working on it at First Year Cleveland.
Got to get some younger folks. Let's see, was it Generation Z that we're into now? Or is it Generation Alpha?
No,
it's Alpha. I can't keep up, I'm sorry. But we need some people from those generations creating that content.
And I can also mention too, so we're excited, hopefully by January, First Year Cleveland will be launching a resource app. It's called First Year Connects, like FYC Connects, right? It's pretty cool. But the first iteration is really to make sure that everybody's aware of all of the great services and programs and organizations in the community. But the next iteration of that will then allow folks to connect with one another. So to address social isolation, so how can we, you know, find ways to protect folks, you know, information, but allow them to connect based off of where they live. And so be on the lookout for the FYC Connects, and that's across the lifespan.
All right, things are moving there.
Yes.
Next question.
Hello, today I am speaking as a Ward 7 resident, And I was very fortunate to have 2 legs of my children. I had the bigs, who were many moons ago, and I have littles. And when I was having my littles, with all this new information that I have, it was very, very important for me to have autonomy in this choice of raising my family. And so I sought vigorously to find a midwife in the community, to find my own way of how I wanted to raise my family. And so I was fortunate enough to have Dana as my midwife. And I swear I wish there was a village of healing where I could have gave birth to my baby, because that's where I would have done it. One of the things that I realized as an advanced maternal age at 40 and 42, having my children, is this fight with the system. I couldn't believe it, you guys. I literally said, no, I am a knowledgeable person. I can say and do and ask questions and navigate this. This is a happy time for my family, but why am I in the fight with the system? Why can't I make my own choice? Why am I feeling this thing, this business, or I don't know, is it racism? But it is a thing. I lived it. And that's why I support what Dana and Jasmine are doing. It's important for families to have those choices. So when you talk about the systems and the business of it all, do they care? Do they know it? I mean, like, the numbers speak for themselves, but there are real people. I am a real person. I am homegrown. I went to Cleveland State. I work in nonprofit. I served in government. I was born at Booth Memorial because my mom was a young mom. So that's taking you all the way back. But
did you have that advocate with you?
I had a doula. I had a midwife. Both times. It was COVID, so Dana didn't get to deliver my baby, but she was there with me every step of the way.
But you still had to fight the systems, even with those supports with you.
Even still, the fight with the system. And so because I had a healthy pregnancy, that's the only thing I feel like that made the difference. But if there was any sight of anything wrong, then I would have been just swept up under the rug of all the things that come along with having a tough pregnancy.
Yeah.
But the business, I guess, my question is like...
Thanks for sharing that. That's a hard question. Do they care?
They do care.
That's hard.
So I can't speak for entire systems, right? But we have so many amazing providers that care and are doing the best that they can. But systemically, I know that there's all these prescribed protocols on what you need and should do. And I think with the introduction, of the Village of Healing model, with the team birth model, and even with nurse-family partnership and midwifery at Metro Health, there is an effort to move in centering the patient and to actually doing what the patient needs and what the patient wants. Now, is this going to be, standard of care? Hopefully, but I think we're building the momentum, and so I understand, because I had a similar problem when I delivered my son. Nobody listened, and I had to go through this process, and it was like a business. And so I think at a state level or a federal level, we do need to think about how do we reimburse for non-clinical interventions during the prenatal and childbirth experience, especially when it lends itself to a healthy birth outcome that thus saves us money in the long run. A lot of that was in the Affordable Care Act. It didn't actually get implemented, but there are opportunities. It's just, we got to get everybody on board.
Yes, because we talked before about how many hospitals will push you towards C-section. When we talk about the business of healthcare, C-sections are billable, right?
At a higher rate, yes.
Yes.
Hi, I'm Dr. Amy Stevens. I'm an obstetrician gynecologist with the Cleveland Clinic.
Hey, yay.
Well, there's some love in the room. That's great.
And the steering committee, First Year Cleveland Steering Committee.
Yes. And, our systems do care. And we have many representatives in this room, but it's hard to move the needle. I have a couple comments. As we talk about changes in government and going forward, philanthropy is going to be more and more important. So we really have to tap into those resources and continue to educate those who will support these initiatives. The challenges, of, Black women giving birth is, not unique, as we know, regardless of your education or your socioeconomic status. But I think that implicit bias does have a great bearing on, a Black woman's experience. And I will encourage everyone in this room, if they can, support implicit bias training at any institution to support it. We have efforts in my system to educate our providers and our residents and have them do implicit bias training. But understand this starts when you make a phone call to make an appointment, right? When you're at the front desk. Or even if you're late for an appointment, like if my patient gets there late, everyone's like, oh, she's always, I was like, I asked the patient, well, why are you late? Did you have childcare issues? Well, bring your kid. We delivered your child. I'd love to see them, bring them. I'd rather you bring your child and not miss your appointment as opposed to just struggle. So sometimes we just have to be a little bit more sensitive. And they're really hard conversations. People, are often sensitive about these things. So, we have to be strategic in how we present this and also encourage others to hopefully support these efforts and fund these efforts.
May I ask you, doctor, are you open, and is the system where you work open to doulas and midwives being a part of the birth experience?
Yes, we are. And I'm a former chair of the Department of Obstetrics and Gynecology at Fairview Hospital, which is a Cleveland Clinic hospital, and the second busiest OB hospital in the state of Ohio, which we're very proud of. But yes, we do have a relationship with Birthing Beautiful Communities, and we have a very robust midwifery program also, headed by Sue Hudson. We have about 40 midwives across the system. So, we are really embracing that. And we also have centering in pregnancy and teen birth. And I sound like a commercial, but I'm so proud. I'm so proud of where I work. But the work is hard. We're not moving the needle as fast as we want. So we just have to continue to move ahead.
Thank you. Thank you for being here. And part of the reason that there was such a big response to the doctor for people who are listening is because she's an African-American woman. And part of the answer is more African-American women, OBGYNs.
Absolutely.
Hi, thanks. I'm Janine Gurgel. I'm with the Bruning Foundation, and I'm grateful for this conversation. And we've talked a lot about health care, but we haven't talked about all of the systems and conditions that also contribute or maybe even play a greater role. And I'm thinking about research that's recently been released by Health Policy Institute of Ohio, talking about what a driver of infant mortality, that the housing challenges our families face. And I know we've mentioned great organizations in this room, Village of Healing, Birthing Beautiful Communities, but also wanted to give a shout out to Pregnant with Possibilities Resource Center for addressing this issue. But this is a big challenge, and it seems really hard to me to figure out what the answer to that one is. Any ideas?
Right.
Well, that's a big question.
That's how we opened up with, healthcare is not the solution. And because we're focused on the documentary, we've talked a lot about healthcare, but women have to leave the doctor's office and do and be. And so housing, yes, is a huge concern, not only here, but across the whole country. We're grateful for the work of Pregnant with Possibilities and a number of other housing organizations here. First Year Cleveland is also implementing the Healthy Beginnings at Home project, providing housing for 24 months with the intention to pursue policy reform that would prioritize pregnancy for subsidy because pregnancy is not a current prioritized population. But it is very true, right? Women, we need to support food around healthy food. I know University Hospitals has a great nutrition program that they're working with. Their families providing food. There's a number of pockets of work being done because we've only housed 7 women with our program. We're birthing around 12,000. And so how do we move the needle? Everyone has to care and be on the same page to uplift and take care of our families. That's the only way.
Back to that question about do they care?
Yeah.
Everybody's got to care. I think we have time for one more question.
Yes, one more. This is a text question.
How can we watch and or stream the American Delivery film?
Great question.
Well, thank you for that. I'm so proud to say that starting on May 1st, American Delivery will be available to stream at pbs.org. And so that we're very excited about. It's the hour version of the film. The longer version will be still available through my distribution company, Kino Lorber. We're delighted to have them on board, but we are really excited about the PBS opportunities, and we're hoping for stations to really embrace it during Nurse Appreciation Week. We're kind of aiming towards that. March also happens to be Women's Health Awareness Month, I believe it is, and also Midwifery Day. So all of those things are converging at once in the month of March, and so we're looking forward to that.
That's wonderful.
Did I say March?
You said March.
Yeah.
Yes, you did. And I'm so happy that we're providing that opportunity for more people to see the film. So Carolyn, your final thoughts on this topic for today? We've covered a lot, but is there anything that we haven't touched on?
Oh, I just want women to be noisy. I want women to say what they feel and know their bodies and have advocates for every step along the way, and wherever we can add a touch point so that women can connect to people who are helping them along the way, whether it's from the minute they find out till they're pregnant all the way through till the children are 2 years old and beyond. I think that's what we need to do, and communities need to come together, and I think people do care. I think people do care all across the board. We just have to remind them what they need to care about.
Angela, your final thoughts on this discussion today? You've shared a lot about what we're doing in Cleveland, and is there anything that we haven't touched on?
I mean, we've covered most of it. I just, our ask, or my ask, is just really to make sure that we all get involved. Like, you have to, this is not something that we can turn a blind eye to, and I feel like no matter who you are and what capacity you serve, you do have a space in this work, because it's not just really about even pregnancy in particular. It's about how do we take care of communities, how do we take care of families. And so, our ask is just get involved, contact us, firstyearcleveland.org, but also partner with a number of the great organizations that
what was that .org? I missed that.
Firstyearcleveland.org.
Firstyearcleveland.org.
Because we do want to build a really shared ownership, in this community with egos aside, and make sure that we all just have a seat at the table. So we're stronger together.
Absolutely. And I want to thank all of you in this room, because I know so many of you are in this space. You're in the trenches every day. You're trying to make sure that women are delivering babies healthy and that the women themselves are staying healthy. So I'd like you to give a round of applause to yourselves. So thank you very much, Carolyn Jones and Angela Newman White, for joining us at the City Club. Forums like this one are made possible thanks to generous support from individuals like you. You can learn more about how to become a guardian of free speech at cityclub.org. The City Club would also like to welcome guests at the tables hosted by Capital Partners, First Year Cleveland, the Metro Health System, and Ohio Guidestone. Thank you all for being here. This Friday, the City Club will close out 2024 with a conversation with Connie Hill Johnson and Kevin Johnson, and celebrate the soul of entrepreneurship and community leadership. You can learn more about this forum and others at cityclub.org. And that brings us to the end of today's forum. Thank you once again to Carolyn and Angela. I'm Marlene Harris-Taylor, and this forum is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.